This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I'm Tanvi Taneja, and with me is R.S. Raghu. The headlines. Prime Minister Narendra Modi appreciates the social distancing initiatives of rural India, says it shows the wisdom of people. Prime Minister asks Gram Panchayats to use digital platforms for better prices for village produce. Home Ministry constitutes 4 additional interministerial central teams for Ahmedabad, Surat, Hyderabad and Chennai to make on-the-spot assessment of COVID-19 situation. Government implements community surveillance at district and state levels to check community spread of coronavirus. Health Ministry asks states and union territories to ensure uninterrupted care of TB patients during COVID-19 pandemic. Uttar Pradesh government announces to bring back its stranded migrant workers from different parts of the country in a phased manner amid the lockdown. And holy month of Ramzan begins today. Prime Minister Narendra Modi hailed the contribution of rural India in the fight against coronavirus in his address on National Panchayati Raj Day today. Interacting with Gram Panchayats across the nation, he said the slogan of "Do Gaj Ki Duri" given by rural India showed the wisdom of the people. He appreciated the slogan, saying that it motivates people to practice social distancing.
आप सभी ने दुनिया को बहुत सरल शब्दों में मंत्र दिया है। न सोशल डिस्टेंसिंग का शब्द प्रयोग किया, न लॉकडाउन का शब्द का प्रयोग किया, बड़े बड़े शब्दों का प्रयोग नहीं किया। आपने सिंपल सा मैसेज दे दिया, 2 गज दूरी का, या कहें 2 गज देह की दूरी का। इस मंत्र के पालन पर गांवों ने बहुत अद्भुत काम किया है। 2 गज दूरी यानी सोशल डिस्टेंसिंग बनाकर रखने से आप कोरोना वायरस को भी खुद से दूर रख रहे हैं, किसी संभावित संक्रमण से खुद को बचा रहे हैं.
The Prime Minister launched the e-Gram Swaraj portal and mobile app as a portal to prepare Gram Panchayat development plans. He said the portal will ensure real-time monitoring and accountability. The portal is a major step towards digitization down to the Gram Panchayat level. The Swamitva scheme was also launched in pilot mode in 6 states to map rural inhabited lands using drones and latest survey methods. The Prime Minister said the scheme will ensure streamlined planning, revenue collection and provide clarity over property rights in rural areas.
स्वामित्व योजना से गांव के लोगों को एक नहीं अनेक लाभ होंगे. पहला तो यह कि प्रॉपर्टी को लेकर जो भ्रम की स्थिति रहती है वो दूर हो जाएगी, झगड़े खत्म हो जाएंगे. दूसरा, इससे गांव में विकास योजनाओं की बेहतर प्लानिंग में और ज्यादा मदद मिलेगी.
Our correspondent reports the interaction was an opportunity to establish a direct dialogue between the Prime Minister and the Gram Panchayat representatives. The Prime Minister also interacted with Panchayat representatives from across the country. Speaking to a Panchayat representative from Maharashtra, he urged to use digital platforms such as eNAM and GEM portal to reach out to larger markets for better prices of their village produce. The Prime Minister also appreciated a representative from Baramulla for coming up with local slogans and spreading the message of social distancing and adherence to lockdown guidelines down to the grassroots.
आपने ह्यूमन रिसोर्स डेवलपमेंट हो, नियमों का पालन हो, बहुत बढ़िया ढंग से किया है और पूरे जम्मू कश्मीर को भी आपसे सीखना चाहिए. मैं आपको बधाई देता हूं, बहुत उत्तम काम किया है और आपके ब्लॉक के सभी नागरिकों को भी मेरी तरफ से मैं बहुत बहुत बधाई देता हूं. और रमजान का महीना है तो आपने जो मेहनत की है उसके कारण रमजान का त्योहार बहुत अच्छे ढंग से नागरिक मना पाएंगे. तो आपने सचमुच में बहुत बड़ी सेवा की है.
Mr. Modi also appealed to people in rural India to download the Arogya Setu app and asked Panchayat representatives to ensure that every person in their Panchayat downloads this app. The Prime Minister also warned against misinformation as an obstacle in dealing with crisis situations. He asked all Panchayat representatives to spread correct information on treatment and prevention of coronavirus to every person. In Jammu and Kashmir, Union Panchayati Raj Ministry has conferred Baramulla district for effectively implementing intensive and structured exercise for planning to Gram Panchayat Zalura of Block Tujja Sharif Panchayat. The requisite parameters of convergence between Panchayati Raj institutions and concerned line departments in the district had also been taken care of. Our correspondent has more.
Ministry of Panchayati Raj Government of India has conferred Gram Panchayati Development Plan Award to Baramulla district in the valley for best planning and performance at Gram Panchayati level in the Union Territory of Jammu and Kashmir. While congratulating the role played by rural development and Panchayati Raj institutions, Deputy Commissioner Baramulla Dr. Ghulam Nabi Ittu has said that Baramulla district has a distinction for having been awarded due to the convergence strategy for effective implementation of different rural development schemes that has enabled the district to create sustainable and durable infrastructure in rural areas and strengthen the livelihood resource base for the rural poor. This is Sunil Kohl for AR News from Srinagar.
The total COVID-19 cases in country has gone up to 23,452. The active cases stand at 17,915 and the death toll has reached 723. Till now, 4,813 persons have been discharged after recovery. Briefing media in New Delhi, Health Ministry officials said in last 28 days, 15 districts have had no new case. He said, till date, there are 80 districts in the country that have reported no new cases in last 14 days. The districts have maintained the status of no new cases and also new districts get added into the category.
कल से आज तक में 491 लोग क्योर हुए हैं, विच टेक्स कि हमारी जो टोटल क्योर होने वालों की संख्या को 4,748 लेके जाती है. इसके द्वारा हमारा रिकवरी रेट अब अप्रॉक्सीमेटली 20.5% है. यह हम सब लोगों के लिए एक बहुत ही पॉजिटिव न्यूज है. इसी तरीके से पिछले 28 दिनों में जिन जिलों से कोई केस नहीं आया है उसकी संख्या में भी बढ़ोतरी हुई है. इसके तहत इन जिलों की संख्या 15 हो गई है और नए जो जिले ऐड हुए हैं उसमें छत्तीसगढ़ से दुर्ग और राजनांदगांव और मध्य प्रदेश से शिवपुरी जिला है.
The official informed that Union Health Minister today interacted with all state health ministers, ministers for medical education and health secretaries through video conferencing to discuss management of COVID-19. Home Ministry officials said the ministry today constituted 4 additional inter-ministerial central teams, IMCTs, each headed by an additional secretary-level officer to Ahmedabad, Surat, Hyderabad and Chennai. Home Ministry had constituted 6 IMCTs earlier to make on-spot assessment of the situation.
कोविड-19 के संक्रमण की स्थिति को देखते हुए आज गृह मंत्रालय ने 4 और इंटर मिनिस्टीरियल सेंट्रल टीम्स का गठन किया है जो अहमदाबाद, सूरत, हैदराबाद और चेन्नई भेजी जा रही हैं. ये टीमें भी भारत सरकार के एडिशनल सेक्रेटरी लेवल अधिकारियों द्वारा लीड की जा रही हैं. इनमें पब्लिक हेल्थ के स्पेशलिस्ट और डिजास्टर मैनेजमेंट के स्पेशलिस्ट हैं.
Home Ministry officials said IMCT Mumbai has suggested installation of portable toilets in Dharavi, Mumbai to augment the number of community toilets. The official said IMCT Indore team has reported that there are 171 containment zones in Indore, of which 20 are critical. She said adequate kits, PPEs, masks and other safety equipment are available and lockdown measures are being followed properly. Director of National Center for Diseases Control said a robust COVID-19 surveillance system is closely monitoring over 9 lakh possibly infected people across the country. He said the sample is taken if symptoms start showing. The NCDC director said surveillance is the primary weapon in the fight against COVID-19. He said government is implementing community surveillance at district and state levels to check community spread of coronavirus.
आज जो विश्व स्तर के सभी देशों में जो हमारी इस बीमारी में कारगर हथियार सिद्ध हुआ है वह है कम्युनिटी सर्विलेंस. प्रमुख हथियार है इस पर्टिकुलर बीमारी में जिससे कि हम सर्विलेंस के द्वारा जिन भी लोगों में ये बीमारी किसी भी रूप में है, चाहे वो हमको सिम्टोमेटिक रूप में मिले, चाहे एसिम्टोमेटिक रूप में मिले या माइल्ड सिम्टोमेटिक रूप में मिले, उन सभी संक्रमित लोगों को हम जल्दी से जल्दी कम्युनिटी सर्विलेंस माध्यम से चिन्हित कर सकें और उनको क्वारंटाइन या आइसोलेशन में तुरंत एडमिट कर सकें.
Member Health in Niti Aayog said The decision to impose lockdown was timely and it was effective in controlling coronavirus spread. He said their analysis shows that lockdown has been effective in slowing the doubling rate of COVID-19 epidemic in India and saved lives.
The measures taken by the government are showing results in the management and containment of spread of COVID-19 infection in the country. During the 1-month-long period of nationwide lockdown, the doubling rate of coronavirus cases has improved from 3.54 days to 10.13 days now. The lockdown imposed from midnight of 24th and 25th of March has slowed down the pace of spread of the virus. More from our correspondent.
In the last 1 month, the government has expanded the healthcare facilities and testing labs for COVID-19 in the country. So far, the number of dedicated hospitals have increased 3.5 times since last month, and number of isolation beds increased by 3.6 times. The number of dedicated COVID-19 hospitals and healthcare centers are increasing continuously, and over 3,773 such dedicated COVID-19 facilities have been identified in the country so far. At present, around 2 lakh isolation beds, 24,000 ICU beds and 12,000 ventilators are in the country. After 30 days of lockdown, when the number of people getting tested has increased many-fold, but the percentage of infected has not shown any exponential rise. Anand Chaturvedi, AIR News, Delhi.
The unprecedented situation arising from the COVID-19 pandemic has created not just a health emergency, but also has placed huge additional burden on the government finances. Here is a report.
The deadly coronavirus has thrown up many challenges. The most important one is to increase the expenditure on health sector in a big way. It is against this backdrop that the government decided to freeze the dearness allowance to central government employees and dearness relief to pensioners between this year and 1st July next year. The combined savings from freezing of DA and DR will be 37,530 crore rupees in the current and next fiscal. Moreover, normally states also follow the central government on DA and DR. It is estimated that the savings on this account from states will be 82,566 crore rupees. And the total anticipated savings of centre and state governments comes to 1,20,000 crore rupees. This will help in fighting the battle against COVID-19 and its fallout in a big way. This decision will also help in welfare measures for various affected sections of society, mainly the poor and the vulnerable. Even 1 rupee is important. Naseem Naqvi, AIR News, New Delhi.
75 million people have already downloaded Arogya Setu app on their mobile phones. Minister of State for Electronics and IT, Sanjay Dhotre, was informed about it while reviewing the initiatives taken by different departments and undertakings of his ministry during COVID-19 lockdown through a video conference today. The minister called this app one of the most important tools in fighting COVID-19 and one of the lifelines for common people during this global pandemic. He requested the officials to popularize this app quite aggressively even in those areas which experience low internet connectivity or has only 2G services. Centre has asked states and union territories to ensure that the diagnosis and treatment of TB patients goes uninterrupted during COVID-19 pandemic situation. Health Ministry has also asked to ensure that all the facilities under National TB Elimination Program remain fully functional. The ministry said if the TB patient is unable to approach the health facility, arrangements should be made to deliver drugs at the doorstep of the patient. States and UTs have to ensure that patients with or without ID receive medicines at a health facility. Health Ministry said the TB diagnostic and treatment services are fully operational. TB patients are being advised about the precautions to protect themselves from COVID-19 and to continue their TB treatment as prescribed. The ministry said health of the patient and healthcare workers remain a top priority during COVID-19 pandemic situation. This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi appreciates the social distancing initiatives of rural India, says it shows the wisdom of the people. Prime Minister asked Gram Panchayats to use digital platforms for better prices for village produce. Home Ministry constitutes 4 additional inter-ministerial central teams for Ahmedabad, Surat, Hyderabad and Chennai to make on-spot assessment of COVID-19 situation. Government implements community surveillance at district and state levels to check community spread of coronavirus. Health Ministry asked states and union territories to ensure uninterrupted care of TB patients during COVID-19 pandemic. Uttar Pradesh government announces to bring back its stranded migrant workers from different parts of the country in a phased manner amid lockdown. And holy month of Ramzan begins today. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
With the sighting of the moon, the holy month of Ramzan began today. Shahi Imam of Delhi's Jama Masjid, Sayyid Ahmad Bukhari, announced it this evening. Muslims around the country will now start fasting for the month-long festival from tomorrow. Yesterday, Shahi Imam had appealed to people to offer prayers at their homes and maintain social distancing.
रमज़ान मुबारक के ताल्लुक से उलमा की शरई राय मुल्क के सामने आ चुकी है कि 5 वक्त नमाजें और तरावी घरों में ही पढ़नी है और सोशल डिस्टेंसिंग बनाए रखना निहायत जरूरी है। एक दूसरे से दूरी और दीगर हिदायत पर अमल करके हम अपने आप को, अपने खानदान और समाज को इस मौलिक बीमारी से बचा सकते हैं।
Vice President M. Venkaiah Naidu has greeted people on the occasion of the beginning of holy month of Ramzan. In a tweet, Mr. Naidu said, Ramzan is observed worldwide as a month of fasting, prayers, devotion, spirituality, faith, gratitude, forgiveness and charity. He said this year's Ramzan comes at a time when the whole world is fighting a battle against the spread of coronavirus on several fronts. Prime Minister Narendra Modi has also greeted people on the beginning of holy month of Ramzan. In a tweet, Mr. Modi hoped that the people will achieve a decisive victory in the ongoing battle against COVID-19 and create a healthier planet. Union Minority Affairs Minister Mukhtar Abbas Naqvi has also greeted people on the beginning of holy month of Ramzan.
In our series Experts Week on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, head of pulmonary medicine AIIMS, has advised the people not to take medicine like hydroxychloroquine or anti-malarial medicine without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other anti-malarials without a proper prescription by a doctor. Do not self-medicate.
Ms. Jacinta Gunjial, Senior Nursing Officer, AIIMS, has stressed on the need for social distancing.
Social distancing is a non-pharmaceutical infection prevention and control intervention to break the chain of infection.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Mahseen Wali, Senior Physician, will participate in this discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. The number is 1-800-115767. One can also ask questions on telephone number 011-2331-4444, 011-2331-4444, and post queries on our Twitter handle @AIR News Alerts by #AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
Now some inspiring stories from across the country. Neeta Lande from Washim district has donated 5,000 rupees in the PM Cares Fund. Despite not earning amid the lockdown from her cloth sewing business, Neeta sold her Mangal Sutra to arrange the money for donation.
मेरी आर्थिक परिस्थिति कम होने के कारण मेरी इच्छा होने के भी बावजूद मैं कुछ नहीं कर सकती थी, फिर भी मैंने मेरे गले का मंगलसूत्र तोड़ के 5,000 रुपए की निधि मैंने हमारे माननीय तहसीलदार साहब के पास आज दी है। और इसी तरह हर एक नागरिक ने जो भी अपने से बन सकता है अपने देश के लिए सहकार्य करे, आगे आइए, हाथ बढ़ाइए, अपना देश बचाइए और अपना जीवन भी बचाइए.
Madhu Kumari from Ramban in Jammu and Kashmir has expressed gratitude towards the government for providing free LPG cylinders under the Ujjwala Yojana.
मेरा नाम मधु कुमारी, मैं दिशक दी रहन वाली हाँ कि जेड़ा लॉकडाउन चला रहा है एरे च मोदी ने सानू 3 महीने सिलेंडर फ्री भराने वास्ते ऐलान किया है। यह सानू बड़ा शुक्रिया अदा करना चाहते हैं।
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and myth-busters. There is a misconception that air conditioners should not be used to cool off heat as they spread COVID-19. In a tweet, Press Information Bureau said window ACs are okay, but not central air conditioners. Busting another claim that dogs and cats, both pet and stray, can spread COVID-19 to humans. It said there is no evidence that coronavirus can be transmitted by pets. However, it said personal hygiene should be followed, like washing hands well with soap and water. Human Resource Development Minister Ramesh Pokhriyal Nishank today felicitated the team of scientists from IIT Delhi involved in the development of COVID-19 probe-free real-time PCR diagnostic kit. He appreciated the efforts of IIT Delhi in developing a testing kit at a very low cost for the people of the country. More than 150,000 farmers and traders have registered on the Kisan Rath mobile app that facilitates transportation of food grains and agri-products. Agriculture Ministry said the app turned out to be a big hit within a week of its launch. In Maharashtra, a total of 559 industrial units have resumed operations as part of easing of restrictions since April 20th in the lockdown in place for the coronavirus outbreak. An official informed that a total of 559 units began production and 8,808 staff have reported to work as of now. He added that the employees who have reported to work have shown no COVID-19 symptoms. Chief Minister of Uttar Pradesh, Yogi Adityanath, has announced that the state's migrant workers who are stranded in different states of the country will be brought back in a phased manner amid the lockdown. He said that the workers who have completed their 14 days quarantine period will be brought back to their native towns. Our correspondent has filed this report.
Chief Minister Yogi Adityanath has asked officials to convey other state governments where migrant workers from state are stranded and have completed 14 days quarantine period to make arrangements to send those workers up till UP border. Once they are brought there, the UP government will then make arrangements to take them to their respective towns and districts where they will be quarantined again for 14 days. Authorities will make arrangements for migrant workers in ashrams and shelter homes with fresh food and other basic facilities, including sanitization. Once migrant workers will complete the 14 days quarantine period, they will be sent for home quarantine with ration kits and 1,000 rupees to manage basic and necessary expenses. Sushil Chandra Tiwari, AIR News, Lucknow.
In Maharashtra, the state government has given permission for carrying out of pre-monsoon related works and metro line construction in Mumbai, Pune and Pimpri-Chinchwad municipal regions. All these four cities have been severely hit due to COVID-19. A report.
Maharashtra Chief Minister Uddhav Thackeray today directed the administration to immediately implement the instructions given by the central team to reduce the death rate due to novel coronavirus and significantly increase the time period in doubling the number of patients, especially in Mumbai and Pune. The CMO stated that the central teams have expressed satisfaction over the state government's large-scale testing. At present, the doubling period of patients in the state is about 7 days and the government is striving to increase it to 10 days. 78.9% of the patients who died in the state had comorbidities and the deceased were in the age group of 51 to 60 years. Meanwhile, the state government has received a nod from the Union Health Minister Dr. Harsh Vardhan to do pool testing and convalescent plasma therapy. Kunal Shinde, AIR News, Mumbai.
In Madhya Pradesh, in the last 24 hours, about 200 new cases of infection have been reported in the state, which has increased the number of infected to 1,846. The number of deaths has also increased to 92. So far, 210 people have been completely cured and discharged from hospitals. More from our correspondent.
Indore still has the maximum number of 1,029 infected patients. Number of patients in Bhopal has increased to 360. Ujjain has also become a hot spot of corona infection with the number of patients has increased to 102. So far, more than 35,000 samples have been sent for investigation from the state, out of which more than 26,000 reports have been received, while about 9,000 reports are pending. Meanwhile, 22 students from Odisha studying at Navodaya Vidyalaya located in Jaora in Morena district are stuck in the school due to lockdown. Morena Collector Priyanka Das reached the school and met all those children and also talked to their families on the phone. She also discussed with the authorities sending them to their home in Odisha. संजीव शर्मा, AIR न्यूज, भोपाल।
In Himachal Pradesh, people from every walk of life in remote tribal Kinnaur district are playing a significant role in the fight against COVID-19. A report.
To prevent the spread of COVID-19 pandemic, a tribal woman, Sunita Negi of Ramni Panchayat from Kinnaur district, is making facial masks and distributing free of cost to local people of our panchayat. These masks not only provided to villagers but also to the migrant laborers. To make this noble cause a success, her daughter Manisha and a local resident Reena both assist her. In order to arrange clothes for making masks, Sunita collects leftover clothes from those villagers who have some clothes left after sewing them. Despite adverse geographical conditions, Sunita Negi's effort to fight COVID-19 is undoubtedly praiseworthy. With Sitaram Negi report from Kinnaur, this is Sanjeev Sundriyal, AIR News, Shimla.
In Tamil Nadu, 114 COVID-19 patients were discharged from hospitals today, while 72 new cases have been reported. 2 patients died, taking the toll to 22. Meanwhile, the state government has declared full curfew for Chennai, Madurai and Coimbatore corporations for 4 days since Sunday morning. More from our correspondent.
Among all the 1,755 COVID-19 patients in the state, Chennai alone has a disease burden of 452, and the number is consistently increasing every day. Coimbatore comes next with 141 people, and Madurai is also considered a potential hotspot. Therefore, the state government has announced that the curfew would be further intensified in the 3 corporations from coming Sunday morning till Wednesday night. For Salem and Tirupur corporations, the curfew conditions have been made stringent from Sunday morning to Tuesday night. No shops would be allowed during these days except those mobile shops selling vegetables and fruits. Except those government offices dealing with essential services which are allowed to function with 1/3 of the usual strength, the other offices have been asked to shut down. It is aimed at reducing the severity of the contagion and further break the infection chain. Jai Singh, AIR News, Chennai.
Meghalaya Chief Minister Conrad Sangma said that testing has been expedited in the state and around 180 tests are being conducted on a daily basis. Besides, more machines will be set up and hopefully the testing will increase. Ahmedabad Municipal Corporation AMC Commissioner Vijay Nehra said the number of COVID-19 patients in the city may grow to 8 lakh by the end of May if the current rate of doubling of cases in 4 days continues. Union Minister Dr. Jitendra Singh today held a video conference with officers of Health Department in the Union Territory of J&K to review COVID-19 preparedness. He lauded the efforts of medical fraternity in combating the spread of coronavirus and said due to the coordinated efforts undertaken, J&K has been able to limit the spread of disease to a great extent. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio on Sunday. It will be the 64th episode of the monthly radio program. It will be broadcast on the entire network of All India Radio and Doordarshan and also on AIR News website www.newsonair.com and News on AIR mobile app. It will also be streamed live on the YouTube channels of All India Radio, DD News, PMO and Information and Broadcasting Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will also be repeated at 8 in the evening. And now, before we end, here are the headlines once again. Prime Minister Narendra Modi appreciates the social distancing initiatives of rural India, says it shows the wisdom of the people. Prime Minister asks Gram Panchayats to use digital platforms for better prices for village produce. Home Ministry constitutes 4 additional interministerial central teams for Ahmedabad, Surat, Hyderabad and Chennai to make on-the-spot assessment of COVID-19 situation. Government implements community surveillance at district and state levels to check community spread of coronavirus. Health Ministry asks states and union territories to ensure uninterrupted care of TB patients during COVID-19 pandemic. Uttar Pradesh government announces to bring back its stranded migrant workers from different parts of the country in a phased manner amid the lockdown. And holy month of Ramzan begins today. And with that, we end the special news program on COVID-19.